Awesome. Well, we're here, not at Mars. We're in Vegas, live at Health. Super excited. We have an amazing special guest, Reza, and we're going to talk about sex, baby. Really, not so much, but anyway. But anyway, I got my special Alyssa here, Suzy. You guys know them by now, and so glad you're here. So
Thank you
really,
so
what are
much.
we going to talk about?
Thanks for having us. So we are talking about 85 million of men in the US that voice concern about sexual health, reproductive health, prostate health, and cancer.
Mm-hmm.
So these men, 55% of them didn't engage in the healthcare setup, traditional healthcare setup, and we are trying to engage them.
Yeah.
So when we are talking about sex, sexual issues are the canary in the coal mine, indication of metabolic issues, hormonal issues, cardiovascular issues, and mental health issues, which we can support holistically those men.
Yeah. I'm so glad you're here because I think this is so important. And, you know, like what you said, the metabolic health, like 30% of all cardiovascular healthcare is cardiovascular disease. It's really, a lot of it's metabolic. I mean, all these factors. So the well-being, you know, I don't even know where to start, but otherwise you're a founder, you're a doctor, you're the real deal. I guess I would like to just step back a second. Like, how in the heck did you get into starting your own company and leaving a practice?
So I personally gone through a fertility journey. I lost my grandfather to prostate cancer. And I was like, this is not the best experience.
That's terrible. Yeah.
That needs to change. There should be a better way to engage men. And then my background, I did my Ph.D. in medical device health technology.
Oh, wow.
And I should have find a best solution to deal with this. And the first problem is access. 62% of the counties in the United States, they don't have urologists. Urologists to men are like OBGYN to women. So we can't blame men not engaging in their health when we don't have access for them. So that was the problem number one we needed to solve.
Wow.
And the second problem is to make it sort of like, there's not a lot of access for diagnostics. So again, we need to solve for that. So at Bastion Health, we are the first and most complete men's specialty digital clinic. Virtual urologists, which we have availability in all the 50 states. We have our testing kits. And then we can test blood analysis. We can do blood analysis, urine analysis, stool testing, semen analysis, and comprehensively help men in the comfort of their home.
Who do you work with? What like, how do you do that distribution network in all 50 states?
So when it comes to physician, we have our medical practices in all the 50 states.
Okay.
We hire and credential of our urologists, and we are the largest virtual urology network now.
Jeez. Wow.
And then we have lab partners and our own test kits that we send to your home. You do the blood testing through an arm-based blood collection.
Wow.
You do the urine testing by collecting the urine in a vacuum tube, put it in the box, ship it to us. Easy.
I feel like you're doing what healthcare should be doing.
Yeah.
Wow.
So on the list of things that you mentioned, I think a lot of those topics people hear about. But the one that you said that really struck a chord was reproductive health. I don't think people think that that is something that affects men, stresses men out, or is a part of the problem. And as there's a bigger shift now here on women's health and maternal health, it's something I remember in med school that oftentimes people can't get pregnant because of some medical reason on the male side. And so maybe you could just talk a little bit about that, because it's something I would love for more people to realize, that there are companies like you that are able to help that.
That's a very good point. 50% of infertility cases are because of male factor. 50%.
Wow.
And still, a lot of the burden is on women.
100%.
So we need to find a better solution to engage men. We need better awareness to make sure couples, before women going through a lot of invasive sort of like testings and diagnostics, know that they need to engage their partner in that and have them do the testing early on. With Bastion, what we do is our workup is pretty comprehensive. We do semen analysis in the comfort of their home. We do blood analysis for all the hormones. And from that point on, they talk to a urologist and get the prescription in order to boost up their sperm counts and chance of getting pregnant naturally.
And I'm glad that you just said that last piece, because I think there's this also misconception. Well, if it's because of the male side, well, we don't want to know. But there is actually hope. Like, there are things that can be done. It's not game over if it is. But there are like instances where, you know, people don't want to know if it's because of some male medical issue. And so the women go through test after test after test. But they're not going to find something.
So if I'm hearing you right, you really should start with the male. It's 54%. It's a step. It's, you know, to do it smartly. Yeah.
The medical protocols is to test men and women at the same time.
Wow.
But from healthcare economics, it makes more sense.
Yeah.
It's much cheaper to start testing men, having the baseline. 2/3 of male infertility cases are because of male factor, because of hormonal health in men, and we can basically treat them.
Who are your competitors in that space? I mean, I know that like Hims does a lot of stuff for male health, but I think they're much different than what you're doing. So tell me a little bit about that.
Yeah, in the B2B space, I think Hims and Roman did a good job in the D2C space.
Okay.
So they made it accessible for a lot of men to get access to ED pills, to hair loss solutions. But when it comes to very comprehensive care, one of our main competitors is Posterity, which is focused on fertility.
Okay.
And they're sort of like helping men that are in the fertility space. At Bastion Health, we want it to be broader wellness solution for men so that we can, while we have them for reproductive health or sexual health, we can help them do the cancer screening and other things.
I love that. So it's more comprehensive.
Exactly.
That's great. That's fantastic.
Yeah.
And how do you get paid? Or do you take insurance, or are people paying out of pocket? Is it kind of a mixture?
We mostly partner with employers.
Okay.
Our main customers are employers, health plans, and Medicare Advantage plans.
Okay, great.
Cool. Yeah.
Fantastic. It's awesome.
Well, I think we've covered a lot of ground. I'm so glad you came. I'm so glad that this topic is huge, and I wish you the best of success.
Thank you so much again.
It's awesome, really.
Thank you.
Nice meeting you.
Thank you.
Thank you.
Thank you so much.